and look.
Hey, Sherry. Good morning, everybody. Stephanie, hi.
Good morning. Good morning. Hello, and thank you all for joining us. The Southeast Mental Health Technology Transfer Center is pleased to present today's webinar event, Perspectives in Crisis, Defining a Mental Health Crisis. We are excited to welcome Georgia Mental Health Consumer Network and our guest panelists as they discuss this important topic. Before beginning our featured presentation, I'd like to review a few some information about our center and a few housekeeping notes for today's events. Next slide. Please note that the work of the Southeast MHTTC is supported by a grant from the Substance Abuse and Mental Health Services Administration, or SAMHSA. Next slide. Our center and the larger MHTTC network use affirming, respectful, and recovery-oriented language in all of our activities. Next slide. The Southeast MHTTC is proud to serve the 8 states in HHS Region 4. Our expertise in public health programs, systems, research, and evaluation provides a unique lens through which we can address mental health priorities. We encourage you to visit the Southeast MHTTC website to learn more about our center. Next slide. And finally, a few important notes for today's event. This event is being recorded and will be made available on our website for on-demand viewing soon. We encourage you to share your comments throughout the presentation using the chat feature. Please remember to select chat with all attendees if you would like to share your thoughts with everyone present today. We have allotted time at the end of our presentation for questions for our presenters and panelists. Please submit your questions using the Q&A feature found at the bottom of your screen. And finally, for those participants who are interested in a certificate of attendance, you may download one after completing today's evaluations. Thank you so much for joining us. And Sherry, I will turn it over to you for introductions.
Thank you so much. Really appreciate it. Hi, I'm Sherry Jenkins Tucker. I'm the Executive Director of the Georgia Mental Health Consumer Network. So delighted to be with you all today. We really appreciate you joining us for Perspectives in Crisis, Defining Mental Health Crisis. I am the Executive Director of the Georgia Mental Health Consumer Network and a person in long-term recovery. And what that means for me is I do what I need to do every day to take care of my behavioral health concerns so I can suit up and show up for my life. I'm also a certified peer specialist and so happy to be joined here by my colleagues, Chris Johnson and Rosalind Hayes. We have a group of panelists that will be joining us as well today, and I really look forward to this event. Roz?
Thank you, Sherry. Good morning, everyone. My name is Rosalind Hayes, and I am a person in long-term recovery. And what it means for me is that I do what I have to do every day to maintain my wellness and health. I am a person who is excited. I'm happy to be here with you all this morning. And what my long-term recovery means for me is that I'm able to be an aunt to my nephews. I am able to show up and support my mother in times of need and when things are going well. I'm able to show up every day and do what I need to do for work. And I am the Director of Peer Support and Training for the Georgia Mental Health Consumer Network. I participate fully in my community. I vote. I am a homeowner, and I enjoy my life. And that is a result directly of being in recovery. And I will give it to my colleague, Chris Johnson, with that.
Hi, good morning, everyone. My name is Chris Johnson. I am a person in long-term recovery. All that means for me is that it's been over 13 years since my mental health challenges prevented me from leading a full, productive, and rewarding life. Today, I am the Director of Communications for the Georgia Mental Health Consumer Network, and that is one of the things my recovery has provided me. A job where I am personally fulfilled, challenged, and grateful. The opportunities I have in my personal life and my professional life today were not really imaginable 14 years ago. And today I walk and feed my dog every day. I walk and feed myself every day. I show up to work every day, even if it's home. And I show up for my family. And those things weren't always true. And I'm just happy to be here today with you all to talk about crisis, because for me, the definition of crisis has changed a lot in those 14 years. What was a crisis before that typically might involve some kind of law enforcement or threat of law enforcement, today doesn't, and it's better. Actually, it's better today. And I want everyone to get to that place where crisis means less and less and less. So I am going to very quickly go through our agenda for today, our learning objectives, which are very straightforward. They are by the end of the module, participants will be able to describe how different groups of people define and use the words mental health crisis, identify how these different understandings impact outcomes, and explore alternate ways of communicating the symptoms of a behavior change. Okay. Now, Roz is going to break our ice a little bit, I believe, with a dyad. Rosalind?
Yes. So what we want to do, we will break you out into pairs. And so a dyad is really a way of gathering information and listening. And so you will be sorted into random pairs, and you will identify person A. Person A will be the person with the shortest first name. And person A will have 2 minutes to respond to the 3 questions that are below. Go back, Chris, please.
Something's happening with my mouse. I apologize.
We won't be able to do breakouts today. And so I guess the thing that we'll do, because we're in webinar mode, so we won't be able to actually have the dyad, but I'd like to ask each of you to think about a time where maybe you experienced a crisis or you witnessed someone in crisis. And the 3 things that we're really interested in with this is, what responses did you get from people who responded to the crisis? What was helpful and what could have been different? And I guess we'll ask you to respond in the chat. Do you think that that'll work for us, Chris?
Sure.
So again, think about a time when you experienced a crisis or witnessed someone in crisis. What responses did the person in crisis receive? What was helpful? And what could have been done differently? We're really interested in, and having gone through this, and like Chris mentioned earlier, for him personally, his definition of crisis has changed, and we found that it just means different things to so many different people. And so if we can get those responses, I see some coming in now.
No, Ross, I remember when I was a teenager and had a very serious but obviously unsuccessful suicide attempt, and was in the hospitalized for a couple of weeks, like in the proper hospital, not the other kind. And everyone felt the need to share their hopeful news with me, whatever it was. And it was Savannah, so there was a lot of church talk, and it wasn't helpful at all. I was 17, so I had some nice words I wanted to say to the nice people, but I knew that they meant well. But in that moment of my life, it wasn't what I needed, and there wasn't any real way that I felt as a 17-year-old to tell them that. And, I wish I had it to do over again, the conversation piece, just to say to them, hey, not now, bad time.
All right, thank you, Chris. And just looking over in the chat, I see remaining calm and listening. I guess those were things that were helpful. Person got support from family. Someone here says a lot of people rush to tell the person what they needed to do. And yes, that has been what I've experienced, do this, do that, and like you said, Chris, that ever hopeful piece, everything is going to be all right. And sometimes that isn't helpful because it just, it doesn't feel in the moment that things are going to be all right. And recognizing, that just the bright, sunny, rosy response doesn't always hit home, or it hasn't always hit home for me. What could have been done differently? Talking to the person in crisis to find out what they wanted or needed. Yes. Rather than deciding on a plan of action for them. Absolutely. Let's see, the person in crisis received law enforcement call to the location to initiate hospitalization. They were handcuffed and taken to the hospital where a crisis counselor was able to help them de-escalate. It was helpful that, I'm sorry, trying to see this. It's hard to get these responses. Chris, are you able to see them in the chat?
I am. Let's see.
Okay. Yeah, here it is. It was helpful that the counselor was able to just sit and listen non-judgmentally. The handcuffing escalated the situation, and the transition from community to officers to hospital also added stress to an already stressful client. Definitely. The person was overwhelmed, shaky, powerless, and very anxious. With breathing exercises, allowing the person to calm down, then listening to the problems, the person was better able to communicate. I'm in trouble over here.
Communicate better and explore the solutions of its triggers.
Yes, thank you, Chris. Thank you.
And when I was in crisis, I was interacted with as less than human. I was treated disrespectfully. I was transported to a hospital where, once again, I was not treated well. The stigma surrounding mental health and substance use created an environment where my voice was not heard, and I was not given resources to address my needs. Yeah, I think, so much of our system is built around stabilization and not recovery. Right? Just stabilize, and especially that 30 days. Try to get everyone stabilized for 30 days. And what after that, That's one of the reasons for this webinar.
Yes.
Talking about what else, what next.
Here's a response that says, I was in a crisis. I was hugged as I cried. No words were spoken. Oftentimes that's what we need, just someone to be with us, just that presence, and not to no words. I really can appreciate that response of just having someone there with me. Oftentimes there aren't any words that are helpful, but just, knowing that I'm not alone in that experience. This one says, seeing the powers mishandle an individual because they are so inexperienced with our population. And, lots of times, people don't know what we need. And so that response that said, really asking a person what they need, is very helpful rather than deciding and taking over for a person.
So someone writes, my oldest son was having a manic attack where he was very delusional, and the police were on the scene and he had to be hospitalized. I remained calm and assisted the police with getting him into an ambulance instead of in the back of a police car. Being I'm also bipolar, I know the dangers of police and the mental health community with my training as a CPS. I was able to disassociate myself from personal feelings and able to calm down a volatile situation.
That's awesome.
Mm-hmm. All right. So we can see here, the different responses and things that are, some of the things that are helpful, some of the things that are not helpful. It was hard because this was the first. I felt like I did what I should have done. I called the sheriff's office first because I was not going out alone. I was not going out alone. He assaulted the police officer and he was eventually taken to the hospital. And it sounds like when the police are involved, that certainly is an escalation of the situation and oftentimes not helpful. Right. So Chris, I will pass it off to you. Yeah.
Okay, so one of the things that I enjoy is words. And guys, forgive me, Roz and Sherry gave me just a couple of minutes talking about this because I'm always fascinated with where words come from, right? How do we get them? What are they even? And with crisis, it turns out that its etymology, which is sort of the study of its history and its evolution, the original meaning of it was Greek, and it meant like a turning point in a disease. And like at that turning point or crisis, you either got better or died, right? Which is just fascinating to me because thinking about the days before anything like modern medicine, you really did typically either recover or die on your own, because we know now that most of the things that they used back then, like leeches and bleeding out and all those things, weren't effective at all and usually actually made people worse. But the idea of there being a split, something that we've talked about in some other work we've been doing with crisis, with the Policing Alternatives and Diversion Initiative of Atlanta, where each crisis really it's an opportunity, but it's also a split, right? It can be a real inflection point in people's lives. And that's reflected here in these earlier definitions, one of which was to separate or decide or judge, to sieve, right? Like you take what you have and you see what is there, and you take what you want from it. And I think crisis gives us opportunities. The first non-medical sense of the word came around the 1620s. And that was when it sort of began to mean what we mean it today, like something bad, right? The other meanings are still there behind it, right? In every crisis, we still make choices, right? We still either recover or die, essentially. In each crisis situation, no matter how small it is, those are our options. So it's good. I just love this stuff. Going back to, there's this German word. It's not typically used in contemporary times, but it's Torschlusspanik, which it literally means shut door panic. So if you've ever had one of those cats who can't decide whether to go in or out, or always wants to be on the other side, regardless of what side it's on, that cat was suffering from Torschlusspanik. And I love that word. It's my new word, but I'm going to have to focus a little more on pronouncing it. So thank you for indulging me with the etymology of crisis. We now know its history. And I am trying to get us to the next slide so we can start talking about some data. So in the survey, we asked folks to thinking about other ways we might try to describe a crisis situation with words that other people would understand our meaning, right? So if I say to you that I have a situation here that is, is crucial that we see somebody, I know now from looking at this list, for most people, and we had a pretty good survey. I mean, over 100 people completed this survey that we sent out. And so that was a pretty good sample for us. And if we know that 100 people, mostly certified peer specialists, but some other folks, we'll get to the people data in a minute. If we say something's crucial, we're going to know that to most people, that means it's not very important at all, right? But we say that it's life or death or an emergency, those have more weight actually with most people than crisis. So we need to be careful with those as well, right? Because if it's not life or death, like literally, we probably don't need to say that, because for most people, that is the language they use when they want to convey the greatest need for a timely response, or when they hear it, they hear a need for a more timely response. So I think that, again, I'm fascinated by words, and just the way that these panned out was just so amazing to me. And essential, I started thinking about it, it's like, I wonder if essential oils cause that word to have so little relevancy in people's minds, because I can't remember how frequently I heard the word essential before essential oils became a thing. But sometimes when words are co-opted, they lose their impact in communicating their original meaning. Because really those oils are not essential. Or I guess they're as essential as people now describe the word essential. Sherry, Ross, did anything on here stick out to you? And if not, that's fine. I can't see your faces.
I was just so delighted about how much interest there was in this clearly crisis, and having various experiences and perspectives with crisis as we have lived our lives with other people. It was really heartening to see how many people responded, a large number for us. And I was very gratified to see that, and it's so helpful for us with regard to doing this work with y'all.
And I just kind of echo your sentiments, Chris, with just the words that are used, and how, like vital and essential, how those things don't really, carry that much weight anymore. And it was interesting going through all of the different definitions and everything, and seeing, the life or death piece of it being so prominent when people think about crises. So this whole process was very interesting, and we will get further into what people, think of when they think of crisis, and the ways that we think of crises. And certainly, with the state of the world right now, this is, very, very timely discussion. And so that is what really caught my attention with this.
Thanks, Ross. Yeah, I was surprised crisis itself actually had as much resonance as it does with people. So just because of the way it's so overused, the stock market in crisis. Well, no, the stock market just does what the stock market does, right? It's always going up or down. There's nothing unusual about that activity or behavior, doing what it's supposed to do. It's like the roller coaster is in crisis. It's like, no, it was built that way, right? So it's doing what it is supposed to do. But people still, that word resonates with folks. And again, that could be because so many of the people who filled this out were certified peer specialists, that it could just be like among our group, among people who share some of our experiences, like our life experiences that we all share together, have the same understandings of some of these words. So moving on, the next question that we asked was sort of the same question, just in a little different language, but it was, from the list below, choose up to 3 words that convey to you the least need for a timely response, and they were the same. Essential, high priority, and vital. People said, those don't say to me that this is important, or important to respond to in a timely way. And all, it doesn't say that it's not important, just that it's not important to do in a timely way. And of course, you know, when you're in a crisis, that's one of the, for most people, you know, defining attributes of a situation that we define as a crisis is that there is a timeliness about it, that it is a time-sensitive matter, that if it isn't handled appropriately in an amount of time, that there may be a negative outcome. So, you know, people can still believe that something is important without it being important right now. But I think the life or death down there, I believe that was just one person said that that was the least need for a timely response. And I believe that person may have had someone, like I had a person in my family growing up for like, you know, until I was in my 30s and that person passed away, who like literally everything, she said, this is life or death. You know, she'd be talking about like needing eggs for a pound cake or whatever. Like, you know, everything was life or death. And so, I mean, that phrase for me just has very little resonance, actually. That wasn't my response there, that one person, but it might have been, because that, you know, again, just that redundancy, that when language becomes common and sort of hackneyed in our ears, it, you know, loses its ability to motivate us. That's for me, for sure. And moving on here to looking at the people who responded and completed the survey, just so you all know who we're looking at. And because people could identify themselves as many of these as they wanted to, we got lots of complex and rich descriptions of people. We found out some of you do a lot in life, like a whole lot. But of the people who completed the survey, 15% of respondents said they were in mental health recovery, 9% in substance use recovery, 12% were certified peer specialists, 3% were licensed mental health professionals, 1% were licensed medical professionals, another 1%, there's just one person, was a first responder. The criminal justice person, I see that there's a negative there. There should not be a negative there. One person was criminal justice, involved with criminal justice. The family members were 12%. The ally friends, 12%. Partner spouse, 2%. Mental health advocate, 14%. Substance use recovery advocate, 7%. Hospital emergency department staff or administration, 1%, that was 4 people. Behavioral health clinic administrative staff, recovery, 2%. Community behavioral health clinic staff, admin, 1%. People who are working with RCOs or peer support wellness and respite centers, just community centers of recovery, were 11%, and staff or admin in a behavioral health allied organization, like a religious organization or civic group. Those represented a percent that got cut off the slide. So I'm going to tell you real quick, because I have this pulled up right here, what that percentage was. We know it was low because it's at the bottom. That was 1% for people. And I also wanted to check up here, first responder, criminal justice, something. I want to make sure I didn't have a typo there, but I see it. I am always happy to correct myself in real time. Okay, so the first responder was one person. The criminal justice, or hold on, licensed medical professional was actually 3 people, and that was 1%. Criminal justice was 2 people, and that was 1%, and that makes that make more sense. So I apologize for my data entry there, but that is, those are the right numbers. Anyone have any questions about the numbers?
I know someone had asked how many people actually responded, and the total number was 97.
Mhm. Anyone else have any questions, or are we ready to move on to the meat? All right, we're ready for the entree part of this webinar, or actually not the webinar. This would be the salad. Maybe we'll have 2 entrees. Maybe we'll have 2 entrees. I like that. Feel like a Golden Corral. Get all we want today. Okay, let's see. We are. Okay. Ross?
Yes, thank you. So in our own voices, what is crisis? We ask, obviously, people to respond to how they think, how they would define crises personally. And we had a wide variation. There were common themes throughout. However, it's different for each person. And so we went through and looked at a few that really stood out for us. And for me, the one that I started with is a crisis is truly in the eyes and the experience of the person within it. It can be something as small as falling and scraping your leg to something related to more acute mental health concerns. And this came from a licensed mental health professional. And this resonated with me because, it doesn't define crisis. It doesn't say, well, it's life or death, or when a person is having suicidal ideations, which is something that, came up very often in the definitions of, when a person is not able to be in control, or they need someone else to take over. These were, things that were kind of common throughout the responses. But again, this one really resonated with me because it is in the eye of the beholder. And because, the word crisis, like Chris mentioned earlier, it's used very often. But I think this speaks to me because it allows the person the opportunity to define what it is for themselves. And it doesn't, box it into any, specific, this is how we define crisis. You have to be at that place of, wanting to hurt yourself or someone else for it to be a crisis. And oftentimes, you find that people, you don't get the response that you're looking for, what you need, and it's like you have to escalate up. It has to be, the crisis has to meet this criteria before it can be responded to. And this really says that it's the person. And if I am experiencing a crisis, no matter how I view it, and I reach out for support, that support should be there. It shouldn't be denied because, this doesn't rise to the standard. And so I really appreciated this definition and how it allows it to be, whatever it is that a person defines for themselves.
And thanks, Ross. I agree. But, part of that is why I like the response I identified here: an acute condition, situation, real or perceived, that rises above an individual's ability to cope or function and places that individual or others in danger of harm, real or perceived. And, it's like, I know when I was in very active addiction, and my drug-induced psychosis never stopped going away when I stopped doing the drugs, right? It started staying with me for longer and longer until basically I was living in psychosis most of the time. And there was nothing you could tell me to convince me that those white vans weren't following me. It didn't matter. They just were, and that fear was real. It didn't matter whether the vans were even real or not. The fear was real. My reaction to it was real. And, it's just a powerful thing that people who haven't experienced some of the things some of us experience at times don't understand how their responses may not be helpful. At the same time, our system isn't, like, as you were saying, designed to support people who are in self-identified crisis. In the beginning of the pandemic, around April 2020, a former sponsee of mine had been in contact with me, and we're trying to get him some support as he was trying to come off heroin. And he went to the local behavioral health provider, and he didn't meet their criteria for admission at that time. And so they turned him away and told him, to come back when he met the criteria. And he went to a hotel room down the street and was dead within 24 hours. And, that to me says, not that our system is broken, and not like some of the things I've been, the Associated Press yesterday described Georgia's behavioral health system as dismal. I don't believe that's true. It is certainly not as robust as others, and access is not as good as others, but I wouldn't call it dismal because I worked in it, and I worked with great people who did some great stuff. And I've met people all over the state doing, the work that we do. And, I don't think it's helpful to think of it as dismal, but it is helpful to be able to point out places where it could be strengthened. I think one of the places where it could be strengthened is, accepting people's perception, right, of whether or not they are in crisis. But if I say I'm in crisis, y'all better get prepared because something's coming. But it's been so, or I guess that it's been so long now that I probably don't really even know what crisis looks like for me anymore. But I remember what it was like before, and having access to services is just so important. And I think one of the reasons I like this definition is because it again doesn't identify a specific behavior, right? Like suicidal ideation, definitely was and suicide attempts were, definitely a part of my crisis history, but they haven't been in the past 10 years or 13 years. That doesn't mean that I have not felt like I was in crisis. Right? When I had a professional failure, right, in my 6 year of recovery, it was traumatic for me, right? But it was just work stuff. It was just a job. But at that moment in time, it felt like the end of the world. And not many people, especially oddly in the recovery community, accepted that my feelings around that were valid. So, and like that definition for that reason. I think if you look at all the different ways this person identifies himself, person in mental health recovery, family is someone with concerns, ally friend is someone with concerns, advocate, staff member, or administrator of a behavioral health organization, the more places the more ways you experience crisis, I think the broader your definition of crisis gets, because you see how different things can impact different people. And I will pass it back over to you, Ms. Roslyn.
Thank you, Chris. Next slide.
Yeah.
Okay. All right. The next one that really that I picked out is this one that says crisis is when someone needs to go to the hospital because they're in so much pain. The part that really resonates with me about this is not necessarily the needing to go to the hospital part, but because they're in so much pain. I find that pain, stress, it is something that is the underlying thing for a lot of crises. People get to the point of not wanting to be here anymore. And if we could break that down, at the bottom of that, there's pain. Lots of folks have experienced trauma and lost relationships and all those kinds of things, and just living in pain and distress day in and day out can be that thing that really pushes us towards crisis. And I think I just appreciated it because it is truly, from a lived experience perspective, obviously. And it speaks to the heart. It speaks to, the person. It really humanizes us and really, talks about those kinds of experiences that we have that are just painful. And oftentimes we're not able to talk through to find resolution for that. And it builds on, builds on, builds on. And, again, I just think that if we could like really break down and talk to a person and say, what got you to this point of crises, oftentimes you would find, that pain is something that is definitely, at the forefront. Just an unresolved pain. And again, carrying that every day in, day out, for me personally, I can relate to that idea, of pain, of stress and those things, pushing towards depression. And then, if I stay in that place too long, it certainly would result in what feels like crisis for me. Yes, I'll give it to you, Chris.
Thanks, Roz. I guess you all can see here that I did not add my other favorite definition of crisis, but I've now sent them all to you all through chat. There's a file that I sent called Crisis Final Wrap, and it has in it all of the definitions of crisis that we were provided through the survey. And my other favorite was this one. It's pretty brief. It's number 61. The handout in chat, and it says, a crisis can be different for every individual and is measured by the extent to which a person is able to return back to homeostasis after going through adversity and or experiencing or witnessing a traumatic event that affects them in maladaptive ways where they lose functional control. That to me was just really powerful. It reminded me of this thing I heard years ago, and I don't even know if it's true, but it's fascinating. And it helped me begin to regulate some of my own emotions. And that was that, authentic emotions only last about 6 seconds, right? Like rage only lasts about 6 seconds. Happiness only lasts about 6 seconds. And after that, everything is reliving that moment, right? Especially like with anger, like the resentment, like we're regurgitating that, we're thinking about it, we're just like boiling ourselves in it. And this reminded me of that, because that ability to let go, that whole grasping thing we do where we hold on to stuff, our ability to let go of fear, of anxiety, of anger, whatever, I think really, for me, I will say, it's just such an important tool for me, because I had trouble letting go of anything before. And it is, I guess that ability to let go that has enabled me to do, a lot of what I'm able to do in life today, and have a happy, joyful, and free-ish life. And I am, just really impressed with this definition. And I don't just like it because of the big words. Homeostasis and maladaptive probably aren't the words I would choose to use to share with a general population this definition, but I do like it a lot. So I guess, Roz, do we have time to open it up a little for people to look at the definitions I sent them, or should we wait until after the panel?
Oh, maybe let's wait until after the panel.
Okay. All right, then Stephanie, if you want to go ahead, and I will stop sharing my screen so that you can take over.
Hey, Chris, thanks so much. I guess you guys are ready to head into the panel. I see everyone's lovely faces. If you guys just wanted to talk instead of just having something on the background, that's fine with me.
Roz?
All right, so we want to thank you all, panelists, for being willing to step up and be a part of this. And first, I'd just like to give you all opportunity to introduce yourselves and tell us who you're affiliated with. And so we start with Denise.
Thank you so much, Rosalind. My name is Denise White. I am the Director of Diversion Services with PAD, Policing Alternatives and Diversion Initiative. I have the responsibility of training law enforcement to respond differently to different community concerns. I'll provide more detail later about that. But I just want to say, just from a personal standpoint, I'm very, my heart is very full right now, and I'm very thankful. I'm learning a lot from you all. So I'm very grateful for this experience, and I can't wait to dive into a deeper conversation. So thank you so much for having me.
Thank you, Denise. I'll pass it to Chris Dowling.
Everybody, my name is Christopher Dowling, and I'm a person in long-term recovery. And I'm also a certified peer specialist. I work at one of our peer support wellness and respite centers here in Cockrell County in Georgia for the Georgia Mental Health Consumer Network. And I'm also our coordinator for our online wellness and recovery activities. So I'm just very happy to be here this morning.
Thanks, Chris. And Michael Clays, please tell us who you are.
Sure. Hi, good morning, everybody. I'm Michael Clays. I'm serving as the acting CEO for Behavioral Health Link in Georgia, which operates the Georgia Crisis and Access Line.
Thank you so much. And so we have some questions for you all, and we'll go ahead and dive in, and you all can respond in no particular order. But since you started working in the behavioral health field, how has your personal understanding of crisis changed, if it has? And I'll throw it out. I'll give it to you, Michael.
Okay, thank you. So prior to joining BHL a year ago, I served as the executive director of the Grady Behavioral Health Services for 10 years. So I've seen crisis, the good, the bad, and the ugly of how we as human beings treat each other in crisis. And a lot of things that were said here today are so important, and things that we try to train our staff at GCAL, first and foremost, that a crisis is to a large extent subjective, right? It's whatever disrupts my equilibrium. Chris used the word homeostasis. It's anything from my girlfriend broke up with me, to I'm getting bullied in school, to a car accident, to I lost my job, to any number of things. So we try to train our staff to listen for what is that precipitating event that motivated them to reach out to call a crisis line, and then secondly, it's our response to that event, whether it's long-term trauma or an initial acute situation that occurs, and that's where the objective part of it comes in, where we do want to identify, is the person's response to this crisis potentially life-threatening, and so we want to try to rule out, is suicide an option for this individual? Are they thinking about harming somebody else? Is the substances that they may be taking life-threatening in forms of an overdose? Because that then becomes a slightly different path of involving emergency services, EMS, mobile crisis teams. But by and large, most people that call, that we interact with, are not experiencing that level of acuity, if you want to use that term, that level of feeling like that's their response. They're looking for support. They're looking for linkage to services. They're looking for someone to appreciate their situation and help provide some guidance. I think you're on mute, Rosalind.
Denise, same question for you. Thank you. Since you started working in the behavioral health field, how has your personal understanding of crisis changed, if it has?
Well, for me, it's about self-reflection and looking at my own personal biases. Just because I think that this is a crisis doesn't mean that's a crisis for the individual. So am I actually causing more harm because we're sending a team out to respond to this request just because, I think it's a crisis or the community thinks it's a crisis? I think a lot of times, our hearts are in it, our intentions are pure, but sometimes we really have to look at our own personal biases and what kind of information we receive throughout our lives, misinformation we receive throughout our lives, and that could really potentially cause harm, even if you have an intention of calling 911 and because you think this person is in crisis. And as we know, that could be a potentially harmful situation if the person could be arrested, then it's escalated and, we actually cause more harm because we thought the person needed the help. So really for me, it is just making sure that when I'm talking with the team, just to make sure that are they responding because this person actually needs support, or are we responding because we feel uncomfortable about something? So really a lot of self-reflection and identifying our personal biases.
Thank you. Thank you. I really appreciate that. And just that idea of just because it looks like a crisis to me doesn't mean that it is a crisis for that individual. For sure. Go ahead, Chris. How is your personal view on crisis or a personal understanding of crisis changed since you've started doing this work, or has it changed?
Yeah, for me, it has changed in the way, and I know Denise and Michael both said it, it has broadened my view of it. Due to my personal experiences and, my personal experience in mental health, what I defined as crisis was based on what everybody else defined as crisis. And so when I felt a certain way, I was like, well, they said I was in crisis, so I must be in crisis. And now it's not that, my lived experience, and also just to see there's so much support out there than just one area. And there's people that can understand what I'm going through and aren't going to judge me for my crisis. And just to be able to be in that and see those differences and being able to broaden my view, that's definitely what changed for me.
Thank you, Chris. Our next question is, how does the organization that you work with define crisis? And you all have spoken to that. Michael, I know you spoke to that a bit. And I guess I'd like to kind of include in that, what are some of the things that have influenced, that way, or how your organization sees crisis? And I will start with Denise.
Well, our mission at PAD is to reduce the amount of arrests for individuals who have unmet needs, right? So for us, a crisis is this person potentially at risk for being harmed because they could, commit an offense, but that offense is due to those unmet needs. We have a lot of offenses here in the city of Atlanta. If you walk, in the middle of the street, if you ask for money, a person could be cited for that or even arrested for that. So for us, we want to make sure that that person has their needs met, so they're not at risk for getting arrested. So for us, that's how our organization, defines crisis. And I'm sorry, did I answer your question?
You did. Yes. Thank you. Chris, how would you say the organization you work with defines crisis?
I think we define it as an opportunity for connection, to be able to be that for that person, to give them a safe place, a non-judgmental place to be able to talk, and to be able to just be able to have somebody there to listen, not necessarily, to be able to sit with them, not to be sitting across the table from them, but to sit next to them and to be there for them, because we were in those same situations before too. Right. And as far as how the organization how we come to where we are is because of all the lived experience that we have. We know what it felt like not to be heard, not to be validated, not to just have somebody there. Like, there's been many times where I was just placed in a room somewhere to calm down. You know what I mean? Like, I have somebody to talk to. I have that now, and I want to be able to give that back. And so our definition of crisis comes from our own lived experiences that everybody in our network has, and to be able to give that safe place and opportunity for that person, to feel loved, to feel appreciated, and to feel cared about. And I think that's what's most important.
Thank you, Chris. Michael.
Thanks. I love what Chris said. I mean, our interaction at GCal really is somewhat different in that it's limited to about a 20-minute phone call on average, right? And so it predicated with kind of assess, provide support, make a referral. That's kind of the framework that the staff operate under. And so, we train them to, we always want to intervene at the least restrictive means possible, right? So if we can help somebody by providing support over the phone, that's a huge success. We can help somebody by transferring the call to the Georgia Mental Health Consumer Network or the CARES network. That's a success, providing that support. Sometimes people need more though, right? They need to go to a provider. They need a mobile assessment to come out. And so, our goal is to really help them work through whatever it is they're calling about in a manner that is obviously respective of their right to choose what they want to do. Sometimes people don't want help. All they want is someone to listen to them, and that's okay. So that's kind of our approach to that.
All right, thank you. So, as we went through earlier, we heard people's individual definitions of crises. And, following in that line, we know that most every organization has its own functional definition of crisis, and that may not align with other allied organizations in the way that they view crises, or their own employees' understanding of crises, particularly, during stressful situations. So when different perspectives arise, how does your organization handle them? And this could be with connecting with other organizations, with folks who work within your organization who might see it differently than the organization does. How does your organization respond when those different perspectives around handling crises, when those things come up and maybe clash with each other? And I will start with Michael.
So for us, it's about continuous training, right? I mean, every individual we hire comes to us with a different background, slightly different education. But we do want to standardize as much as we can our approach to helping somebody who is in crisis. And so if we record calls, we listen to calls, we have a pretty rigorous quality improvement process. And if we, are identifying somebody who is going to be much more inclined to call law enforcement, for instance, as opposed to send out a mobile team, we're gonna intervene and make sure that people are well aware of providing the least restrictive measures possible.
Thank you. Denise.
Yeah, I want to just highlight what Michael was saying regarding training. And, training is so vital in making sure that, first of all, everyone is implementing the proper techniques and strategies, but also, are we on the same page with our values? Do you believe, like for us, we believe in harm reduction. So that means that we need to find providers who also believe in harm reduction. So if our values do not align, we're going to have to keep searching and searching, because there are a lot of barriers that prevent a person from receiving the best care possible because of going back to those values, right? So for instance, if there's a clinic that says you have to have a state issued ID to receive services, and a person doesn't have an ID and it could take an incredibly long time to get an ID, that could be a huge barrier for someone seeking services. So we want to make sure that we are partnering with agencies that have the least amount of barriers and their values align with ours.
Thank you, Denise. Chris, do you want to answer that question? And
Yeah, I'll do my best to answer that one. I just think, and it was mentioned, I think Denise meant, it's just the training and the the trainings that we go through with our, our CPS training and the training we go through at the centers, wherever we are at the network, like it helps us be able to have, be on the same page of our viewpoints or how we want to go in to be able to support somebody. And there are differing opinions, and I think that's okay. You have room for that, but there's a time and a place for that. And sometimes when we're being able to support a peer, we have to set aside our personal views and beliefs and all those kind of things and be there for them, because that's what's most important. It's not about what I think, it's about what they think and what's best for them.
yeah, thank you, Chris. All right, so we all know that sometimes responses to crisis, it can be more harmful than the crisis itself. Some of the ways that crises are responded to. Without providing any identifying information, please share with us the worst response to a behavioral health crisis you have encountered in your personal or professional life. And talk about what could have been different or what could have been done better. Chris, I'll start with you.
There was a lot of things that went through my head with that question. As somebody who has been involved in mental health on a personal aspect since I was a child, back in the 90s, mental health was a lot different back then than it was now. And, I know Chris Johnson mentioned it, I'm a 2-time suicide survivor myself, so I've seen the good and bad of both of those sides of it. But the one that probably stuck out to me the most was, it was somebody that I had went through a different kind of mental health center with, and they said they cried wolf too much. They were always talking about they're in trouble or they're in crisis or they're feeling this way or they want to kill themselves. And the providers got tired of hearing it and just didn't believe them and pushed them away, and that person ended up committing suicide. And to me, that was the worst side of it. Because as somebody, like I said, has gone through a lot of that, it doesn't matter how many times I've said that I'm hurting, or maybe times I've said that I wanted to die, that I didn't do it. It doesn't mean I wasn't serious at that time. And it doesn't mean that I didn't need support, so be able to give that support, no matter how many times that person is in trouble or going through anything. You're there for them no matter what, because you just don't know what that person is really going through. So I think for me, that was probably the worst thing that I've had to see and go through and experience. And I'm so glad that we are getting so far away from just pushing people away and being able to listen. So thank you.
Thank you, Chris. Michael?
Yeah, the worst thing I've seen, that's a question.
Mm-hmm.
Yeah, so again, 10 years at Grady, you see a lot, and I would just sum it up with the overuse of force, period. Whether it's restraints, handcuffs, mace. I've just seen a lot of bad things that mostly, unfortunately, generated by law enforcement, trying to calm down a situation and just escalating it. So yeah, it's we're a long way from where we need to be.
And so thinking about what could be different or how we could address that, what would you say to that, Michael?
We get Denise and her PAD team out there every time someone needs help, instead of over medicating them and putting them in the back of an ambulance. I mean, at the end of the day, the good news is I think we are moving towards a substitute for law enforcement when somebody's having a mental health crisis, and the need for mobile teams and pre-arrest diversion programs, all of that is is a huge benefit for everyone involved. And so obviously law enforcement, they play a part. CIT training, I think, is something that's important for them. There's a lot of work to be done there. I've worked very closely with them, so they want to get out of the mental health business, right? Nobody blames them, and yet, there's not necessarily enough resources to be able to intervene quickly enough, and so the blue lights come out instead of a team of people, which may take a little extra time, and so I think that's the difficulty of this.
Thank
And then
you.
folks need a place to go other than jail, right? They or an emergency room. That's not appropriate either. And so, diversion centers are very much needed, and where they exist, they're very, helpful in meeting someone's basic needs, de-escalating the situation. That's certainly a resource that's very important.
Thank you. Thank you. All right, Denise, same question for you.
So I think this is the part where I'm going to go into more detail about PAD. So, we have the law enforcement component to PAD where law enforcement can actually call us if they see anyone who has any kind of unmet needs due to mental health concerns, poverty, and or substance use. They actually don't have to arrest the individual. They can call us and we can go out to the location and actually provide services and support to that individual. So we have the law enforcement component, but then we also have this community component. So if the community sees anybody who has quality of life issues, they can contact 311 and our team will go out to the scene as well. So I think we received a call one time from a community member, and the community member said that this person was experiencing a mental health crisis. Please send out a team. And the team went there and he was just listening to AirPods and he was just dancing to the music that he was listening to. And he felt very offended, and it was a very difficult situation for us to be in because we want to honor the community and we want to respond to those requests from community members. But also, I think it's going back to the self-reflection piece that sometimes we have to just take a moment and not put our own personal biases on that situation, because you just don't know. Like, someone literally could be on the phone with their AirPods and just talk on the phone. So sometimes we just need to pause and just do a bit of reflection. Is this person really experiencing a crisis? Because we think they're experiencing one. So I think for us, we are doing a lot of community education around, when to call 311 versus 911. And, we're doing a lot of just community engagement, because I think for us, just approaching that individual, and the person honestly was harmed emotionally. It's like we have these systems that we're navigating. I'm a woman of color, so I deal with a lot of issues, and so we basically perpetuated a system of oppression. We, in a way, by approaching this person, we assumed that this person needed our support and needed our help, but he was literally just listening to music.
Mm-hmm. Wow.
And that was it.
Yeah.
So I just think, something that we need to do differently is just keep, educating the community on, the services and just life in general, just more education.
It's challenging because, you talked about, this person wasn't experiencing a crisis, but someone outside looking in assumed that they were. And then to hear the flip side of that, when person is actually in crises and is reaching out for help or support, and finding that support is not available for them. I'm personally aware of several cases, like at least 3, where the mishandling or the denial of support ended up in death of the individual. And that is totally, totally heartbreaking and unacceptable. And so I'm with you with the education, and destigmatizing and kind of just allowing space for people to be people. And at the same time, there's that balance, or it's that dance of, does this person need support? Do they need help? And I think being able to talk to people and communicate and being able to ask that question, what's going on? Are you okay? How can we support you? In cases where we can communicate with folks, that would be, the way, just ask them, to approach them and ask them. But, oftentimes when we see things that make us uncomfortable, we respond from fear, and fear can really give us some unhelpful outcomes. We'd like to end on a hopeful note, and I really thank you all for your thoughtful comments today. But reflecting back over the past few years, what changes have you seen that make you hopeful for a better crisis response in your community or in the state of Georgia? What keeps you hopeful? What changes have you seen? And I will start with Michael.
So this is a national initiative of having a 3-digit number of 988 that will be used as an alternative to call 911. And that number goes live July the 16th. And so that gives me hope that people, GCAL has a 800 number, which is, we had 275,000 calls last year, but let's face it, a 3-digit 988 number is a lot easier to remember than an 800 number. And so that opens the door. It improves access tremendously for people. And obviously once that call comes in, we have to have ample staff to provide the support and the linkage to help that person. And so there's a lot of activity going on at the federal level, at the state level, to be able to provide what they call the 3 legs of the stool: someone to call, someone to go see that person, and some place to go. And so I'm hopeful that we're, much like you would call years ago in the 60s 911 for an ambulance, 911, and then an ambulance, someone to go see them, and obviously a hospital. The behavioral health field is slowly catching up to that, where hopefully in a few years, the use of mobile teams will be very prevalent. People will be able to access services a lot easier than they can today, and therefore some of these crises can be prevented because getting the education and the care earlier on will help everybody.
Thank you. Chris, I'll give it to you next.
Well, I think Michael mentioned earlier, and especially in my community, I live, ours is a more rural community down here where I'm at our center. But CIT training is huge down here. There's been several CIT trainings with our sheriff's departments and different things like that. And also they are aware of the Peer Support Wellness and Respite Center, and also the other ones in the state. I think those are becoming, we have evidence that shows how much the centers are helpful, and how much having to have certified peer specialists and peer support in general, that it is a real thing. This ain't something that we just made up so we didn't have to go to the hospital. This is a real thing, and I think the community is starting to see that. There's community education and communication in general, with fire departments and police, and they know about our centers. And I've had we have people that come from all over the United States that come to our community because we have a huge rehab there. And so they come and they're like, what is this respite center? What is this peer support? And they're like, I wish I had this in my state. Maybe I wouldn't get this far if I had something like this available to me before, and for them to be able to see that and have the same awe that I had with, what is this? What is peer support? And it just getting out there, and that the community comes together. We have a community that comes together, and just being able, our resources are more available. We have technology, we have social media. There's so much out there that is slowly taking away that stigma of somebody who has mental health challenges is a person too, you know, and that we don't need to be put away somewhere, you know, that we're right there with you. We're your brother, we're your sister, we're your friend, your coworkers, you know, we're just human. And I feel like we're being more humanized the more we go on with this. Thank you.
Thank you, Chris. Yes, 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 yes. And thinking about, you know, in Georgia, you know, with this being the year for mental health and really, you know, a focus on the mental health concerns of people of the state. And, you know, resulting from the pandemic and you know, the economic things, the justice challenges, and just so many things that have been going on. And, you know, I think about, again, certified peer specialists being in NICU units and you know, being in private settings now, and the spread of peer support is something that certainly keeps me hopeful. So I echo that with you, Chris. And Denise, what keeps you hopeful? What changes have you seen?
I just want to agree with Chris. Peer support is so vital. Human connection is so important. And I think that, you know, if I'm speaking with someone and they've gone through what, you know, with what I'm going through currently, then that message is going to resonate better with me, you know. So I totally agree, Chris. But also, I just want to say that I'm glad that we're moving away from just there's only one number to call. If you know there's an emergency, call 911. If it's not an emergency, still call 911. You know, there's other options that are available that weren't even available 5 years ago. So I'm really thankful that right now there are more options, more services, and we're getting away from the stigma of mental health. You know, we are humanizing it. I'm just so excited that, you know, as a society, we see how important language is. We see how important just self-reflection is as well. So I'm just happy that we're just moving into the right direction with services and more peer support.
Thank you. Thank you. That was the final question. And I guess that was a great way to end, but I will give a little opportunity if there's anything that you want to say that you haven't had opportunity to say yet before we move back to the general session.
Thank you for bringing this topic up. It's a great discussion.
Thank you. Thank you all for your willingness to be here.
Yeah, I just want to echo that. You know, I'm very thankful and grateful to be part of the conversation. And I just hope that we can have more conversations like these. And I hope we can have a better network of connections. And I just want to highlight I think people don't know how courageous it is. I know I'm personally impacted as well, but just it takes a lot of courage just to get through the day. You know, we talked about the stressors of the day, the traumas that we experience, and that is so courageous just to navigate the day, you know? So I just want to highlight that. And again, thank you for having the discussion.
Thank you.
And I just want to say, you know, these webinars that we have, and this is just another piece, you know, to help get us to where we ultimately want to be as far as, you know, mental health recovery and being able to open up those lines of communication and the resources. This is another step forward. And when we do these webinars, so very grateful for these.
Thank you. Thank you. And this is just the first in a series around crisis and crisis response. And so stay tuned. There's certainly more to come. Chris, are you around? Thank you all. This has been wonderful. And I think we might have a few minutes, Chris, to open it up to the definitions. And if there's anything that anybody wants to share with that.
I'm shocked we haven't heard from Gina Olszewski, because I believe I saw her earlier. I thought some of those definitions would have poked her a little, but I guess not. Did anyone have anything to add or about, well, if not the definitions that were provided to us, your own definition or anything that you heard today that stuck out to you? You can raise your hand, or Stephanie, can they unmute themselves?
I see here from Jeffrey, it says, I believe a crisis is anything you can't figure out on your own. I have five adopted kids that my parents and sister had adopted who never received counseling. And it's daunting to say the least, because I believe our system doesn't really recognize the need for mental health, the needs of the mental health community. And it's a fact that more than 50% of the jail population has a diagnosis. And if we can address this, we can change a lot of lives. I have two of the adopted kids at my house at the moment. One was just diagnosed paranoid schizophrenic the other day, and the other one was diagnosed with depression after he had a stroke last year at the age of 24. It's a lot. That's a lot. And you know, that idea of, I believe a crisis is anything you can't figure out on your own. That's an interesting perspective. Thank you, Jeffrey.
And Jeffrey, you're definitely right about, you know, our system's capacity for handling, well, most anything at this point. But, you know, our legislature is looking at that. It is the year of mental health. They are doing a deep dive into, you know, what isn't working, what could be better. But there isn't, you know, short-term specifics in the legislation that we've seen that, you know, says, okay, we want these services in these areas by this date. It's all just sort of loosey-goosey. And I don't know, in my experience, you know, trying to overhaul massive systems, and I have been a part of that before, is not as massive as that, but, you know, it really takes a plan. Not just, okay, make it done, you know, and I don't, I wish there were more details about what the system that's being envisioned by our legislators and other leaders looks like. Because that would be really helpful in building support for it. Knowing, for instance, that peer support will be a vital part of it. You know, that would make it a lot easier for lots of people to cheerlead. But hopefully we will find out some things over the next couple of weeks before the legislative session ends and this gets voted on, to give us all some comfort, because like if you're on this webinar, you know, that legislation will impact your life in some way or another, either as an employee somewhere, a consumer somewhere, just a peer living in the community. All of our lives will be impacted. So the crisis system included. Anyone else?
Well, here's one I want to share. We've heard some not so positive experiences, and so here's one that said, I had a great experience with DeKalb City Police or DeKalb County Police, an individual who could have easily and justifiably gone to jail. Officers handled the situation with empathy and worked as a team with direct care staff. The individual was able to avoid incarceration. Officers stayed until the person was transported to the hospital. I was impressed. So it's nice to hear, you know, a positive kudos to the police. You know, you don't hear that too often. So that they, and we do have the CIT trained police, and I actually, you know, we've called the non-emergency police before, and they have handled situations in a way that was, you know, caring and you know, with compassion. And so, you know, it's not all bad. We are moving in the right direction.
Okay, everyone, Sherry, do you have any final word before we hand it back over to the Mental Health Technology Transfer Center of the Southeast?
Just wanted once again to thank everybody, Roz, Chris, and our panelists, Denise, Chris Dowling, and Michael Clays. We're so appreciative. I'm so appreciative to all of you. The Georgia Mental Health Consumer Network is so delighted to be able to do this work with the Southeast Mental Health Technology Transfer Center. And as Roz said, stay tuned. This is a first in a series of webinars we're going to be doing on this related topic. So please join us again, and thank you so much.
Thank
Bye,
you all.
everyone.
Thanks, everybody. Great work.
Thank you.
Thank you all so much. Sherry, I echo those same sentiments. Thank you all so much for joining us today. We're definitely grateful for this opportunity to have this discussion and share the individual and organizational perspectives on this important topic. As Roz mentioned, we will have future events, so I encourage everyone to visit our website or sign up for our newsletter to get those updates on when we scheduled those future events. I posted in the chat a link for everyone to evaluate our event today. We appreciate your feedback. It helps us improve the services and activities that we offer. So please feel free to click on that link and let us know your thoughts on today's events. And that concludes today's presentation. Again, thank you so much for joining.